But at the same time, we are aware that in that time span, our emissions will increase by over 65%. And as we've already heard, the health sector is one of such sectors that contributes to these emissions. And therefore, it's a key imperative for us as sector players to identify avenues, opportunities, ideas of how, as a sector, we can reduce our own emissions. And I will leave that with you. Secondly, is the issue of financing. Now, global commitments to financing climate action, and especially the intersection between climate change and health, has fallen short of our expectations, but also commitments that have been made over the years. As an example, the $100 billion annually that was promised by our partners globally has not been realized. Over 70% of countries in sub-Saharan Africa and other low-income settings have demonstrated that they do not have the requisite financing to finance actions that will enable them adapt to the effects of climate change, not only to their health systems, but to also the lives of the people in the communities. Now, again, I will refer back to our nationally determined contributions. Assessing the cost of implementing, coordinating, and delivering the targets we've set as a country in our nationally determined contributions would require about $28 million. And the financing available locally, or that we've committed to make innovative ways of accessing financing, utilizing, allocating, prioritizing financing to ensure that at least we have the resources necessary for us to meet the targets we've set for ourselves as a country in the nationally determined contributions. One more key sector that the health community should be very concerned with is the food and agriculture sector, directly impacted by the effects of climate change. Climate change does affect food availability, quality, and diversity, which exacerbates the food and nutrition crisis. It drives crop failures, but also it reduces availability of land to sustain agroecology and productivity. We have already seen instances of droughts and the debilitating effects they've had on the communities that have experienced this. As I mentioned earlier, climate change does not only impact the vectors that cause us diseases, but it also impacts on the pests that affect our food. We are very aware in recent days when we had an infestation of locusts that put close to 25 million people in the region at the danger of food insecurity. Now, one may wonder, why is it of special attention that we look at the food and agriculture sector? Recently, we have just seen the results from the Uganda Demographic and Health Survey. And we have learned that close to 25% of children under the age of 5 are stunted. This means that they have a low height for age. And therefore, they are not growing at the rate we expect them to grow at. But also, they are not meeting their developmental milestones. Secondly, close to 3% of those children are actually acutely malnourished, which means that they have a low weight for their age or for what is expected at their age. Now, this malnutrition in childhood and also among pregnant women has many adverse consequences. For one, child survival. 2, long-term well-being, but also has far-reaching consequences for human capital development, for economic productivity, and national development as overall. And therefore, when we are looking at these issues at this symposium today, we should desist from the tunnel vision or the idea of working within silos. We need to foster a multi-sectoral, multidisciplinary approach. And it is for that reason that we've invited actors from several sectors to ensure a cross-sectorial dialogue, to ensure a cross-disciplinary ideation, to ensure that what the health sector is planning, the transport sector knows. What the agriculture sector is planning, the finance sector understands the imperativeness and the importance of these actions to guide the appropriation and allocation or prioritization of resources. Now, as a country, and again, we will hear from the communications on the nationally determined contributions, we've chosen a low-carbon path for development, but also made the decision to focus on adaptation as our core response to climate change. And adaptation means that we adjust our natural, but also our human systems in response to the actual estimated or expected effects of climate change. It means we build a health sector that can predict, that can cope, that can respond, and that can continue providing services despite the adverse effects climate change will throw at us. And to do this, we need to espouse locally led adaptation measures. Because unless they are locally led and locally driven, they will not be able to reduce the vulnerability to climate-induced health threats. And later on, we will hear from the Vulnerability and Adaptation Assessment for the health sector in Uganda, what key vulnerabilities we have within the health sector to stimulate the discussion on how these should be addressed. Now, we recommend the government of Uganda.
I personally work with internally displaced people, and one of the most concerned is that depressive episodes after the disasters, because these disasters come with losses not only for life but also their property. So it is imperative that we interest ourselves in how we can mitigate these disasters, but also develop responsive measures that clearly towards the effects from these disasters. Without further ado, I will call Dr. Nomthando Lukele from WHO, who is going to tell us building low carbon, climate adaptive, and resilient health systems. Thank you very much.
Thank you, Crispus. Mwasuze Mutia Basebo ni Banyabo. Ladies and gentlemen, good morning. I'm Dr. Nomthando Zolukele from the WHO Country Office. I'm the acting cluster leader for communicable and non-communicable diseases. I am here on behalf of the WR, Dr. Jonas, who would have loved to be part of this important discussion, but due to competing demands, he is out of country and could not be here. And therefore, I'm grateful for the opportunity to be here, to also tap into these discussions, because as a medical officer myself, this is an area that we are behind when it comes to preparedness, even awareness. So we are grateful for this opportunity, for the WR's remarks as they are written. Honorable members of Parliament, Embassy of the Federal Democratic Republic of Ethiopia representative, Permanent Secretary and colleagues from Ministry of Health, colleagues from Ministry of Water and Environment, colleagues from Ministry of Finance, colleagues from UNDP, UNICEF, UNFPA, Red Cross, colleagues from academia, CSO, and NGOs, ladies and gentlemen, good morning. On behalf of the WHO representative, it is my great pleasure to address you today. I am honored to stand before you today to address a matter of paramount importance: the urgent need to support building of low carbon, climate adaptive, and resilient health systems in Uganda. Let us begin by acknowledging the reality of climate change's toll on global health. According to the WHO, between 2030 and 2050, climate change is expected to cause an additional 250,000 deaths per year. This is primarily due to malnutrition, malaria, diarrhea, and heat stress. It is unfortunate that these impacts are disproportionately felt by the vulnerable population in low-income communities, making it essential for us to act decisively to mitigate these consequences. The health sector is uniquely vulnerable to climate change, yet it also holds the key to building resilience within our communities. A health system that is low carbon, climate adaptive, and resilient is one that not only mitigates its own environment impacts, but also prepares for and responds to the health challenges exacerbated by climate change. Allow me to share some specifics regarding the health challenges posed by climate change in Uganda. One is on vector-borne disease, and with malaria as an example. Malaria is a climate-sensitive disease which already accounts for a significant health burden in Uganda. The changing climate conditions, especially the rainfall patterns, has led to a geographic range of malaria vectors expanding, putting more communities at risk. Uganda is also experiencing a heightened frequency of extreme weather events, including floods and droughts. These events not only directly impact health, but also disrupts the health infrastructure and services. The floods almost every displace people and increase in waterborne diseases, highlighting the interconnectedness of climate and health. Changing climate patterns affect agricultural productivity, leading to food shortages and malnutrition. In 2022, WHO announced the Greater Horn of Africa drought response as WHO Grade 3 emergency, with populations in Karamoja facing food insecurity due to climate-related factors. Additionally, access to clean water is compromised, leading to a rise in waterborne diseases with cholera outbreaks. It is evident, therefore, that climate change is not a distant threat, but a present danger demanding our immediate attention. In response to these challenges, it is imperative that we focus on building a health system that is not only responsive to current needs, but is resilient in the face of changing climate. A low-carbon climate adaptive health system is not just a vision, it is a necessity for the well-being of the people of Uganda. Ladies and gentlemen, firstly, reducing the carbon footprint of healthcare facilities and operations is crucial. Sustainable practices such as energy-efficient infrastructure, waste reduction, and use of renewable energy sources can significantly contribute to lowering emissions. By embracing these practices, we not only contribute to global efforts to combat climate change, but also create a healthier environment for patients and service providers. Secondly, the health sector must adapt to the changing climate to effectively address emerging health risks. This involves strengthening surveillance systems to monitor climate-sensitive diseases, enhancing early warning systems, and developing robust response mechanisms. Additionally, integrating climate considerations into healthcare planning and infrastructure development is essential to ensure the sustainability and effectiveness of health services. Lastly, building resilience within the health system requires a collaborative and multi-sectorial approach. Governments, non-governmental organizations, communities, and international partners must work together to pool resources, share knowledge, and implement innovative strategies. This collaborative effort is crucial for not only tackling the immediate health impact of climate change. The World Health Organization stands ready to support Uganda in the transformative journey towards a low-carbon, climate-adaptive, and resilient health system. We will provide technical assistance, share best practices, and facilitate partnership to ensure that the health of the people of Uganda is safeguarded against the impact of climate change. In conclusion, the time to act is now. Let us come together to support building of a low-carbon, climate-adaptive, and resilient health system in Uganda that not only heals the sick, but also protects the health of future generations. By investing in low-carbon, climate-adaptive, and resilient health system, we are investing in the well-being and sustainability of our communities and our planet. With these remarks, I wish you a fruitful symposium. Thank you.
Put your hands together once more for Dr. Namtandazo for such an insightful and very factual presentation. And to me, what stood out in that presentation was the fact that the specifics where we're talking about climate change, worsening vector-borne diseases like malaria, which is very much climate sensitive, but also talking about extreme weather events. Now, if you're familiar with the news, especially with flooding, you see how the infrastructure is being washed away. So it is not only the roads and the schools that are being washed away, but also the health facilities. I'll give you an example. In western Uganda, Klembe Mines Hospital was closed by Ministry of Health because of seasonal flooding. And this hospital was serving over 50,000 people in that region. So imagine, where are these people getting health services from? So, and then also how we can decarbonize our health sector in Uganda. They gave us solutions of investing in clean energy or using clean energy sources. So, and then also a call for collaboration, because climate change is a very big topic that as a sector, a health sector, we cannot work on it alone. We need everyone, a whole society approach. When we are, if we want to be sure that we get very good results in our actions. But also I want to highlight where they said we have to act now, because most of these things we have been pledging, like Dr. said, some of our partners in the Global North pledged annual finances that up to now have not been realized. So it's the time now that we don't just pledge, we don't just talk, but we rather act. And if we are to act, let us act collectively. And this can be shown by this symposium, how our audience is full of representation from different sectors, CSOs, different government agencies, and private sector. So, I mean, we have to act and act collectively if we are to achieve climate action, especially in the health sector. That being said, I'll invite the representative of our commissioner, the commissioner climate. Sorry. Okay. The representative of Margaret Atieno, who is who is that? Do we first have to do a concert, something? Okay. Mr. Muhammad Semambo, the Principal Climate Change Officer in the Climate Change Department from Ministry of Water and Environment. Please, the floor is yours, and he's going to talk about health, focus health from African Climate Summit to COP28. Please. The floor is
yours. Good morning, everybody. Good morning, everybody. My name is Semambo Muhammad, and I work as the Principal Climate Change Officer in the Ministry of Water and Environment in the Climate Change Department, and my task is very simple today, just to deliver a message on behalf of my boss, Mrs. Margaret Atieno Mwevesa, the Commissioner for Climate Change Department. First and foremost, I will start by sending apology for Madame Mwevesa for not being with you here, because there's also other important engagements actually she's involved in about carbon trading. She's been assigned by President to do some paperwork on that regard, but requested me to deliver the message on her behalf. So, as you note from the agenda, I'll start by appreciating the organizers of this conference, and specifically I saw on the program that there is Tree Adapt, then there is Ministry of Health, I think, on behalf of Government of Uganda, and the World Health Organization. But of course, when you note here, I think there are a number of partners beyond that. So I will not sing out each and everybody, but I would just want to thank everybody who has made contribution, whether financially or technically, to ensure that we have this symposium. On the subject which Madam Commissioner might have said, allow me to say that as Government of Uganda, we moved ahead of recognizing the importance of health in terms of addressing climate change. Those of you that have been following how our national planning is in terms of addressing climate change, I think health is one of the sectors that we treasure in terms of addressing climate change. And for the reasons which I'm going to just mention briefly. Number one, it is on record that the health sector has been impacted by climate change. You saw what happened with the flooding, more especially in the western part of the country, that one of the infrastructures that were affected is actually the health system, isn't it? There were the health centers that have been affected, but also you note that when we have floods in Uganda here, we have a lot of issues related to the water quality. And when you have issues related to the water quality, the end result is about the health of the people. So that is number two. Number three, it is also important to note that as temperatures have been increasing in this country, there are certain places that were used to be called malaria-free areas, more especially in the highland areas. So in that regard, we've been seeing increase in malaria as a result of increasing temperatures. And specifically when you go to areas like the Chigezi Highland, when you go to the mountain Elgon, some of those areas, those who are old enough, they used to say that they were malaria-free zones. But with the increase in temperatures, there are incidences of malaria that have been reported and have been increasing cumulatively. So that indicates that we have issues to deal with health in relation to climate change. So name it, but you also have others that are related to the correlates that have been happening around the country when we have extreme events like floods, among others. So the health that we're talking about can also be capitalized in terms of the feeding that we have. So when we have a lot of droughts in this country, there's a lot of food insecurity. And the end results, you are seeing issues coming out with malnutrition, among others. But again, we have also issues to deal with brain traumas that are happening. There are so many people that have been borrowing money to invest, maybe in agriculture, but with the increase in terms of climate change, you could see that most of them are unable to pay back these loans because of the climate change. So as a result, it's not only about the health of the issue to do with food security, maybe water, but even others may have indirect implications as a result of climate change. So a number of them have been failing to pay back their loans that they have bought to invest in agriculture, and what happens is the issues of madness and so many other things. So you cannot remain the same when a climate catastrophe has happened. So there are so many things that you can attach to health in that regard. And then I want you to note that the national projections have already made in terms of temperatures and precipitation. Things are not going to be the same. The temperatures are projected to increase in the range of 1 to 2.5 in various areas. So if temperatures are going to be increasing that range, in the business as usual, but looking at the three models, it means that there is also direct and indirect implication that may affect the health sector in that regard. So when the temperatures increase in the range of 1 to 2.5 in various areas, what does it mean in terms of health? I think most of you here are health experts. And then in terms of rainfall, the rainfall is projected to reduce in the range of 5 to 15, that is in terms of percentages. but in various areas. But we also detect that there will be some bit of increase in terms of rainfall, more especially in the southwestern highlands, that is the Chigezi Highlands. But the rest of the other parts of the country, what is being projected is a reduction in terms of rainfall in the range of 5 to 15% in that category. But the Central Cattle Corridor is the one that will be most affected. So now the issue is that, what does that mean in terms of health? And when we talk about health, we are talking about the food, we are talking about the water, we are talking about the human themselves, but also talking about the health of the animals, among others. So, and I keep on warning people that health goes beyond what the Ministry of Health is doing. It also goes beyond what the Ministry of Agriculture is doing, because we're talking about health for the animals, which the Ministry of Health is not doing because it's not their mandate. We are talking about health of water, and in terms of that is talking about in terms of the quality of water that we are going to be using, and it could be going beyond the Ministry of Health, and then you need to add up all these dots. But also there are accidents that happen with climate change. We've been seeing a lot of accidents happening with climate change, and the end result is about loss of livelihood, but also loss of lives. So as we talk about health, I think we should open up to go beyond the human health, but also there is other health that could be complicated, and also the accidents that could come or that result from the adverse impacts of climate change. So we, on the record, when we have the floods, at least you hear people that are being killed as a result of floods. When we have landslides, you hear a number of people that have been killed as a result of landslides. So, Climate Change Action Plan, which is the NDC. So when we look at the NDC, we have done high-level impact assessment in terms of vulnerability of climate change. So apart from ecosystems, water and agriculture, I'm confident in saying that health is coming in number 4 in terms of being at risk, but also being vulnerable to climate change. And therefore, that caused that we need to have a special climate change action, that is the adaptation plan for the health sector, that could bring out the details. Like you do the science, you model, you come up with the risk, the hazards and risk that could affect the health. That is the human health, but also the health care systems in Uganda, to ensure that you climate-proof them in terms of planning for them and also addressing climate change in that sector. So it is one of the actions that is required by the Ministry of Health to develop a national health climate change plan. That is the NAP for the health system in this country. So it is that requirement that could also necessitate what we need to do in details as government of Uganda in order to address climate change in the health sector. So that means that you are going to look at a number of things, because some of them could be like accidents on the roads as a result of poor feasibility, others could be associated with water, others could be associated with food that we eat, the diseases that can be manipulated as a result of climate change, and so many other things that may come, but also the resilience of the health infrastructure system is really very important. But we recognize that from the health practices, there's also issues that are related to mitigation. Because the way how you manage the waste in the health sector is very important. The previous speaker has mentioned it. We need to look into that. We talk about how people are cooking and the source of energy that they are using for cooking. They also have health implications. So how do we address all this across all the spectrum? I think it is really very, very important, because most of the diseases, most especially the respiratory diseases, can be coming from pollution. And pollution sometimes related to the energy that we use for cooking, most especially the indoor cooking. So we have so many things that we have to relate to the health sector, but in relation to climate change. So that said, the Ministry of Health, you have around 4 things that you have to address in terms of implementing the national determined contribution, which is the National Climate Change Action for this country. And I'm very sure that the Ministry of Health is on course, because DID has engaged us that you are doing a vulnerability assessment for the sector that will inform the development of the health sector for this country. And that one will help to bring out the details of what we need to address. But also, leaving that aside, I would say that in the UN system, the health has not been pronounced in terms of the negotiation. So it is of recent that the World Health Organization, coupled with the AGN, I think, that is the Africa Group of Negotiators, they saw it wise that we need to bring health negotiation in the UN system. And you could recall, those of you who have participated in the summit, the Africa Climate Summit, that happened in Nairobi last year, that health has been discussed but has not been given the due consideration in terms of the bigger decision making. So at that level, what happened is that the AGN, but also with the high-level ministerial meeting was conducted, and the issue is that how do we institutionalize health in the UN negotiation, and that is in climate change negotiation. So, and I think this is really something very, very important, because on record, if you don't have a thematic area to negotiate under the UN, then that means also the resource mobilization, the capacity building, and the technology required will not be given due attention. So, as Africa, I think it is really very, very important, and all developing countries, that we need to consider a broader institutionalization of the health negotiation in the UNFCCC. Because at that level, you have now a thematic area or a block where you can bring in the issues related to the health that could help to mobilize adequate resources, the required capacity building, the technology which is also required, and then you'll be able to address climate change and health. So in simple terms, this is what happened during the climate summit, which happened in September, that a group of health advocates, government, and key negotiators, they felt that we need to bring this to the attention of the UN, that is the United Nations Framework Convention on Climate Change, to institutionalize the negotiations in relation to health and climate change so that they can be given due consideration. And I think moving forward in COP28, it will be very, very important to continuously push this and be able to see that health is given key attention, because at the end of it, when we talk about climate change, the end result is about the human and lives, isn't it? If you're talking about resilience in ecosystems, you want people to live in a better way, isn't it? When you talk about resilience in road infrastructure, you'd want people to live in a better way. When you talk about resilience in water, resilience in agriculture, the end result is that you would want to improve food security, and food security is about the quantity, but also the quality of the food that we eat. And in energy, name it, because at the end of it is about the lives of people to live with climate change and also address the causes of climate change in that direction. So I think that is really very important. Those that are going to negotiate climate change come Dubai, starting this month and ending in around mid of what? December, is that we need to push for health. And to me, I would say that as we try to push for health as an agenda, we may need to take it as a cross-cutting issue, because you could realize that some of the intervention that we're pushing for are falling in other sectors. So we need to take it as a cross-cutting issue in that direction, but also importantly is that the ultimate goal is that how do we mobilize resources to implement our health agenda and climate change? How do we mobilize technology, development and transfer, but also how do we mobilize capacity building to ensure that both the human health and the infrastructure in the health system are resilient to climate change, and they are low carbon in terms of their development aspiration. So with that, I thank you very much for giving me this opportunity. I have made this on behalf of my boss, the Commission on Climate Change, and I wish everybody good deliberation within this symposium on climate change and health. Thank you very much.
Thank you, Mr. Semambo, for fully representing your boss. Mr. Semambo highlighted the key aspects in national planning on the health sector in terms of climate change. And I would want to also emphasize this. Health is not, as WHO defines it, as a physical, psychological, and social well-being of an individual, not merely an absence of a disease. So it's not usually only like physical diseases. Oh, I have this infection, I have this disease. But there's a lot. It's a cocktail of a lot of factors that define health. And that is what he was talking about. So he also talked about projections in temperature increase, which obviously affects our ecological health. As someone who is coming from the cattle corridor, there's a lot of resistance from the pesticides nowadays. And we are wondering why. But it's obvious that with the increase in temperature, some pests are favorable. The increasing temperature gives favorable environment for these pests, which increase their resistance towards the known pesticides, and obviously affecting the livelihoods of those who depend on the cattle and other livestock. So it's very important. But also one key issue is the health negotiations. Mr. Semambo can tell you I was always in our youth negotiation training, I was vocal on things to do with health. Where is our position as the health sector in our national position paper? And because health is not a thematic area yet, we can only talk about health in things like adaptation, mitigation, capacity building. But I believe that with engagements like this symposium, actors in the health and climate space will push for development of health in the UNFCCC processes as a thematic area, such that we can negotiate on what we want in the health thematic area in regards to climate change. And so I'll go to our next speaker, who is going to talk about health in our country's NDCs, the nationally determined contributions. And allow me to invite Cecilia Alonyo from the Ministry of Water and Environment to to give us a presentation on that. You're most welcome, Cecilia.
Thank you very much, everyone who has attended this symposium for health and climate change, and all protocol observed. I would like to start off this presentation. Actually, I'm so very excited that Mr. Semambo Muhammad is around, because he's one of the experts in this, in coming up with Uganda's nationally determined contributions. Yes, I would like to. Okay, so the outline of my presentation is just very, very simple. I have the background for the NDC, and then I also have how the NDC's processes were, the planning processes. I also have the scope on the NDC, and then the projected CHC emission levels, and then also the Global Health Alliance and health in NDC, and then means of implementation. What you should know is that NDCs are just what countries have come up with to reduce on their emission levels. So Uganda submitted her NDC on the 12th of September in 2022 to UN, which is United Nations Framework Convention on Climate Change, as a fulfillment for Paris Agreement Article 4, which requires countries to come up with their emission reduction targets. What are your reduction targets for? And parties are supposed to come up with these in a period of 5 years. So it's a 5-year range of, yeah. So the first NDCs, the first initial NDC had a target of 22%, 22 emission reduction targets of 22, but right now the updated NDC of 2022 talks of 24.7% emission reduction targets. And what you should know is that these targets are brought about by mitigation and adaptation actions. And this will enable Uganda to fulfill some of the commitments stipulated under sustainable development, such as Sustainable Development Goal 13, also the Sengai Framework for Disaster Framework, and the NDC is also aligned with Uganda's Vision 40, and also aligned with the third development plan of, yes. So coming up with the NDC, it was informed by the policy by the documents that you see right there, such as the National Climate Act, the National Climate Policy of 2015. These are some of the documents that informed what should be in the NDCs of Uganda. Yes. During the process of development of the NDCs, you'll find that the NDC is sensitive to gender issues, both in adaptation and mitigation actions. What you should know that this is the outline of the updated NDC. It has national circumstances, it has adaptation components, it has mitigation components, and it also has means of implementation. But the country's priority was on adaptation, and where adaptation addresses vulnerability and also increasing resilience of sectors and resilience levels of sectors, and also addressing loss and damage. Yes. So what you should know that Uganda, in 2005, the carbon metric ton of carbon dioxide equivalent was 53.2%, 53.4, but this has gradually increased to 90. And this shows you that there is an increase in human activities, sectors, different sectors like energy, we have industrial processes, and we have agriculture, we have waste. Some of these sectors are gradually increasing the levels of carbon dioxide that is in the atmosphere. And we see that greenhouse gas emission projections by 2030, we shall see that there's an increase up to 148 metric ton of carbon dioxide equivalent. And this is if nothing is done. That is BAU, which is business as usual. If nothing is done to come up with actions to eliminate greenhouse gas emissions, we shall see that there will be an increase to up to 235.7 metric ton of carbon dioxide equivalent. Yes. So adaptation processes and planning, these are some of the events that took place during coming up with adaptation components. And why am I talking about adaptation? Because this is where health issues are mainly handled in. And we see that there was a climate risk and vulnerability assessment that was done. I'm only going to mention health. Health, as you can see, a rating on health is 3.67. That's the vulnerability rating. And then we also have a risk rating on health, which is 3.33. Yeah, so we see that these climate change impacts are affecting health, infrastructure, food insecurity, water resources, and climate and energy and ecosystems. Yes, so the Global Climate and Health Alliance did an assessment on the healthy NDC scores of countries, and these were countries that submitted their NDCs from 1st October to 21st October, from 1st October to 23rd October. And the GCHA was looking at health, was looking at integrating health governance, was looking at when NDCs were being the process of developing the NDCs, what was done, was health impact looked at, was health sector consulted, are there some core benefits of health, are there some core benefits, and also what are the economic and financial implications. And the scores of all these categories were 8. And countries like, actually, Burundi had scored 17 out of all these in their indices. So I would like to say that Burundi is doing very well. But you'll see that Uganda actually scored 11 out of 18. So you'll see that in intergovernance, where the health sector was consulted, so Uganda scored 1, some of the impacts, Uganda scored 1 as well, and then health sector actions towards climate change, addressing climate change, Uganda scored 3, and some of the core benefits were 3, but we don't see any economic financing in health. So Uganda scored 0, and also monitoring and evaluation, Uganda had 3. So Uganda scored 11, but some of the countries like Burundi, just our neighbor right here, East Africa, scored 17. So in Uganda's NDC, we see that if health is integrated and health is looked at as some of the sector that climate change is really affecting, we shall have a sustainable and resilient health sector. And we also see that some of the core benefits will be in sectors like health, water resources, and waste. Climate financing, this is some of, Uganda requires about 28.1 billion to implement its NDC, both mitigation and adaptation actions. But unconditional means the amount of money that the government is supposed to come up with, and then conditional means these are money that is supposed to be, finances that is supposed to be mobilized. But all these are cross-cutting in areas of technology, areas of gender, development, and capacity building. Yes. So thank you for listening to me, but if you want to you can get a copy of Uganda's NDC online and also look at what has being done in the area of health. Thank you very much for listening to me. That was it from me. Thank you.
Thank you so much, Cecilia, and a very big round of applause to Cecilia for that wonderful presentation. The NDC is an important tool for us as a country because we signed under the Paris Agreement, and this is one of the mandatory things that we have to do every period of 5 years. And I'm happy to see that we are scoring highly, more than some other countries, though I think there is a room for improvement. But my key takeaways would be on the means of implementation, climate financing. You saw that we need 28.1 billion US dollars to implement our NDC. And only, I think 4 billion US dollars are availed by the government of Uganda. So where's the rest? We have to mobilize. And this has to do with the government, but also the private sector and civil societies and everyone who is here. So when you go to these engagements, especially COP, the upcoming COP, please try to pitch these projects that you're doing in the health space that are connected to, of course, climate change. I would like to invite our next speaker, who is Didas Namanya from Ministry of Health, and he's going to talk about, he's going to recap on the Uganda's National Adaptation Plan of Action, focus on health. You're most welcome, Didas.
Good morning, everyone. I would like to take this opportunity to present the recap of the National Adaptation Programs of Action. I think a recap is intended to see where are we coming from, where are we, and where are we going in terms of climate change. I think in the wisdom of the organizers of this symposium, it was important for us to understand where are we coming from. So in that perspective, I will show some bit of history, what we did in the past, and project the health aspect of the NAPA. So could we go to the next slide? I have to do it here? All right. I was not oriented, so some IT person needs to come and orient me in this one. How does it work? I think we should go manual, the old way, tapping. All right. You could do it there, and so that is more efficient. So ladies and gentlemen, my presentation will cover the background. It's actually working, maybe in different positions. All right. My presentation will cover, it will be very brief, it's about 18 slides. the background to the NAPA methodology, very important, because we are still doing studies, and it could be a lesson for us to understand how we can do it best. Key health-related findings, are they still relevant? You should understand that we did the NAPA in 2007. It's almost 20 years since we did it. So we are trying to examine, is this still relevant? And lessons from the NAPA process. So the NAPAs basically was based on the fact that the UNFCCC acknowledged that some countries are more vulnerable than others, especially the least developed countries, where Uganda falls. And island states that are in the oceans are more vulnerable because of the economies that we have, and therefore they were asked to develop reports that could quickly communicate their vulnerability to climate change. And that was in Marrakesh in COP7. We are now in COP28. So you can see the time when these least developed countries were asked to develop a report to communicate the immediate challenges they were facing as far as climate change was concerned. So the NAPAs was provide a quick channel of communicating urgent and immediate adaptation needs of LDCs to the conference of parties. I think they fell short of communicating, and so what? Because as you will be seeing in the end, many of the projects that were suggested by the NAPA were not funded, were not implemented. So it was lacking in terms of what was to be done after the communication. So that is the document. I think you can also access it online, and it has all the information that I'm going to summarize here, especially regarding to health. So the methodology, we have been talking about multi-sector approach. We have been talking about multidisciplinary approach. It was very comprehensive as far as those aspects are concerned. The overall lead was the Ministry of Water, Lands and Environment. At that time, those ministries were still together. For those of you who know the transitioning, Lands is now independent, but at that time it was still one ministry. Then we had the Project Steering Committee as the key top technical team, Project Management Unit, and then the NAPA team, and then task forces. I'll go a bit into the detail. So those were the members of the Project Steering Committee, representatives from all those ministries: agriculture, health, finance, tourism, Ministry of Water, Lands and Environment, Department of Disaster Preparedness, Office of the Prime Minister, education, local government, justice. We even had justice. I think climate change has got issues of justice, equity, NGOs. We had CSOs and NGOs. We had focal points of UNFCCC. I think that is the Ministry of Water and Environment. So this was the composition of the NAPA Project Steering Committee. Then we had the Project Management Unit and the NAPA teams. The Project Management Unit was made of 2 project managers and chairs of the task forces drawn from different disciplines. But disciplinarity was key in the NAPA process. Then we had the teams. This was a broad-based team composed of technical officers drawn from all those ministries that I've just mentioned. And they were in charge of implementing the activities. It was basically doing the assessment. We had 3 task forces: agriculture and water resources. We had health, and then forestry and wildlife. But you should note that all these teams tackled climate change regarding the highland ecosystem, the lowland ecosystem, the aquatic ecosystem, semi-arid ecosystems, and the Lake Victoria Basin. We wanted to cover the whole scope of the country, looking at those ecosystems. That is briefly the description or the distribution of the districts. At that time, the districts were still very few. I think there were around less than 100 districts. Much of those districts have now been cut into smaller pieces. But you can see we covered a broad aspect of the whole country looking at those ecosystems. The highland areas, mountainous, the lowlands, the cattle corridor, we try to cover all those regions. So what specific methods did we apply? We did literature review and second data sources, which were analyzed both online, published literature, and so on. We used surveys, focus group discussions were done, key informant interviews were done, but more specifically, we did participatory rural appraisal. I think those of you who went to university in the 90s and 80s, that was a very important methodology of doing rural research. It has transitioned into now the key informant interviews and things like focus group discussions, participatory methodologies, qualitative methodologies. We didn't do much of quantitative methodologies. It was more of qualitative methodologies and consultations. So we did ranking of interventions that were discussed in the district, regional, and national consultations, what we called at that time validation workshops at the district level, at regional level, and at national level. We held many consultative workshops because at that time, climate change was a new idea. We have now transitioned into, most people know about climate change, but in the early 2000s, it was still a new idea, a new phenomenon, so we had to raise awareness, discuss, and consult people about their ideas about climate change. I don't know whether you are able to see those, but what is important is that we found major disasters through the PRA or participatory appraisals, and droughts, floods, and all those disasters were registered. And these have very serious impacts on health, as the previous speakers have already mentioned. Then we had major impacts of malaria, of other factors, major impacts of disasters on the health sector that were picked from the PRA discussions. I will not read all those. Some of the speakers have mentioned about the impacts being direct and indirect. The direct impacts, of course, include like the diseases, they include the destruction of the infrastructure, they include the things we face directly. Flooding, when it happens, it washes away latrines and all those kinds of things. But indirectly, like mental health, the people who deal with the injuries, the injured people, the deaths, they are mentally affected. So climate change has both direct and indirect impacts on health. We find that as far as diseases are concerned, malaria, diarrheal diseases, direct injuries and deaths were some of the things that were discovered through these assessments of the NAPA. Among the diseases, we had malaria is key, cholera is still very pertinent because of the flooding and poor water resources that we have. Injuries, deaths, mental health, all those were discovered during this NAPA assessment. Now, during that time, we tried to find out how do the communities cope in terms of facing the climate change challenge. And we found that these are real, actual, on-the-ground responses, exploitation of aquatic resources, especially during drought, because when there is drought, things like fishing increase and looking for food in the wetlands. Food preservation, we found unique ways of preserving food for the future, especially when climate change impacts are anticipated, like putting meat in honey. In Kapchorwa, they preserve meat in honey for a long period of time. Use of herbal medicines, renting land, and using unconventional foodstuffs. All of us who are here, I think you know, during famine, we tend to resort to things which we didn't used to eat. The types of matoke, which are normally used for brewing our local blue. Instead, we turn to them and start eating them. Wild yams and such things that we didn't used to eat. So, in the cattle corridor, we had issues of water harvesting, the dams that were constructed at that time, soil conservation, using special plants, changes in husbandry practices, self-help initiatives, traditional vector control. For instance, in the cattle corridor, we found that people can use burning of cow dung to chase away mosquitoes in the households. This is a unique aspect and indigenous knowledge. We had issues of increased encroachment. Some people encroach on national parks, on wetlands, in order to survive. Special practices of hygiene, hand washing, especially during flooding. And we also found out that there are district disaster management committees which were established in order to respond to climate change hazards. But these normally become active when the disasters actually happen. They are normally latent during the most of the time. Let's look at category B, coping strategies. Some of them are very interesting. Shifting cultivation, incursions in wetlands, again, migrations, people migrate to other areas, especially urban areas, especially males. Because they are unable to provide for the households, they tend to migrate to urban areas to run away from responsibility, I guess. Sale of assets, household assets, in order to survive, and start up stocks. You know, in our culture, we keep seeds for next planting season. So people eat these seeds when there is climate change stress. Encroachment on wetlands, exploitation of forests. Very interesting, we had famine marriages. This is very interesting because some families would marry off young girls to get dowry in order to survive. This was very serious, especially in the eastern part of the country. Hunting of wild birds and animals. And some people coped by just idling, going into the trading centers and idling. I don't know whether you're able to see this, but these are the final list of prioritized interventions that we picked in the NAPA assessment. The ones I've highlighted with a pointer are those related to health, water and sanitation, water resource use, and of course health. They are categorized in terms of urgency, immediacy, and coverage. So lastly, we look at the NAPA projects. The NAPA identified 9 projects that would be implemented in order to tackle the climate change challenge. But as I conclude, you can see that community water and sanitation project, it was a very well developed project. Vectors, pests, and disease control project, and then climate change project. The 3 of them were very relevant to the health sector. But as we go ahead, now the technology is misbehaving again.
Please make it work.
Nay. I would like to now conclude by looking at the lessons. What are the lessons of this NAPA? Is this still relevant for us today as we tackle the climate change, as we go to the Conference of Parties in Dubai? Is the NAPA still relevant? I think it is. It pioneered the countrywide assessment of climate change in the early 2000s. Throughout the participatory appraisals and consultative workshops, we were able to raise awareness, and I think by this time we are continuing to raise awareness. It documented climate change coping strategies, which are still relevant. We may need to analyze this further. It promoted public-private, public-public partnership, which is very key in tackling the climate change challenge, because it is a cross-cutting factor. The academia was involved, and it promoted transdisciplinary people from water, people from health, people from agriculture. We came together and worked together to have a report, to have recommendations. Most of the proposed NAPA projects have not been implemented. That's a big question. That's a big pointer. Where do we go? As we go to COP28, can we see that the reports, the ideas we have can be funded? Can we have homegrown sources of funding for our projects, climate change projects? More importantly, the NAPA methodology and approach can still be applied. As we do studies and assessments, we can apply the NAPA approach. With those remarks, I want to say thank you for listening. I look forward to any discussions and questions or comments. Thank you very much.
Thank you, Mr. Didas, for an exhaustive presentation on national adaptation programs of actions. And without wasting time, I would like to request Mr. Didas to share with us that presentation, such that anyone of us who might want to have a look accesses it. I would, from there, I want to invite Mr. John Bosco Isunju straight away to tell us more on climate vulnerability and adaptation assessment, progress, and preliminary findings. Mr. John Bosco, you're highly welcome.
Okay, thank you very much, moderator. And my name is Dr. John Bosco Isunju. I work with Makerere University School of Public Health. I am the team lead on the assessment, VAA and HNAP, which is Climate Change Vulnerability and Adaptation Assessment, which we are conducting nationally to inform the development of a national health adaptation plan. Already, previous speakers have been talking about it. We are here to implement it, and we are being supported by Rockefeller Foundation that gave us a grant, but also we are using some methodologies from WHO and collaboratively working with the Ministry of Health. So just to quickly take you through the background, already various speakers have talked about the health outcomes, both direct and indirect, those that affect the infrastructure, and the direct health outcomes like the burden of disease. Of course, these result from the change in environmental determinants of disease, such as creating breeding sites, creating food insecurity, and affecting shelter issues. And these eventually precipitate the outcomes that we see. And we live in a region which is really infested or rich with all these disease organisms, disease-causing organisms. We call it viruses, the hosts, the vectors. So any slight change in environmental conditions actually triggers the proliferation and change in life cycles of the vectors and the hosts and migrations, etc., which leads to spread of the diseases. We have challenges of competing needs. We're a developing country, and these competing needs affect how we adapt, how we prepare, because we tend to come in to respond. And yet climate change is calling us to get prepared, to prepare so that we reduce risk. The health managers and health workers lack awareness on climate-related health issues. There is inadequate collaboration between the actors, the various stakeholders, difficulties in mitigating emergencies to climate change. And of course, the district level structures are ill-equipped to cope with climate-related challenges. So, over the different COPs, including COP27, Uganda committed to developing a national health adaptation plan, and prior to that, to conduct a VAA. So we have been working with the Ministry of Health, trying to look for funds here and there, and the WHO. And luckily, we got Rockefeller to commit to support us. And in this assessment and the plan, eventually we are having 4 main objectives. One is to assess the climate change related risks, both present and future, and then looking at different areas like the workforce, the infrastructure, the energy, water and sanitation. And then we look at the impacts, because when you look at in assessing risk, you look at the hazard, and then you look at the exposure, and then vulnerability, and then the capacity to adapt. If the capacity is not there, and you have the hazard, you have the exposure, then you're going to have an impact, or you will have a risk of an impact occurring. So we are assessing the current impact and the potential of future impacts. What happened in Kilembe, for example, is an impact. It's not a risk. It really happened, and we saw the hospital being swept away. So that is an impact. And then we're looking at mitigation, adaptation, and response plans. or which would eventually inform the national adaptation plan. And we're also looking at mechanisms for ensuring that these adaptation processes are monitored, they're implemented, they're evaluated, and improvements are done over time. So findings, so far we have been to all the facilities that we targeted, 726, or around in 43 districts. And in terms of the levels, you can see majority were lower level facilities. The green showing health center 3s and the yellow showing health center 2s. And you know that these facilities, the lower level facilities, are scattered in rural areas, and most of these are within vulnerable areas. Some of them are up in the highlands, others are in low-lying areas but embedded in communities. Others are very difficult to access, so they are affected whenever it rains. Majority that we studied are government-owned. Now, we wanted to first filter to see which facilities or region or district is affected by what hazard. Because you need to first see, is this hazard there? You cannot go, for example, to Soroti and look for landslides. It is flat, so you need to first filter out. So that's what we first did, and what we saw is that majority of health facilities were really exposed to drought, highlighted in red there, nearly half, nearly 50%, 47%. And also nearly 40% were exposed to floods. So if we're talking of the major hazards that are affecting the health infrastructure or the health system, you're looking at droughts and floods, and then we have storms coming up at 31%, and then the water level rise. You remember Lake Victoria rose at some point, and then in Bulisa and those other low-lying areas, they have also experienced water level rise, and some facilities have been submerged. So this is slightly different from the flooding. The flooding may happen over a short time. Okay, so this is just a demonstration of what happened, an impact I just described in Kilembe. So this is what happened in Kilembe. The hospital was swept away. And when we were trying to categorize the impacts, we categorize them as major, moderate, or minor. So the description is given here for what we are calling a major impact, a minor impact, and others. So this is just to show you how our methodology is going to run so that you don't get confused as we go along. And then for vulnerability, we also categorized the vulnerability. For example, if we're looking at the component of health workforce, we want to see the extent to which this health workforce is vulnerable to a particular hazard. To what extent is the health workforce vulnerable to floods? And to what extent is the health workforce vulnerable to storms or heat or water level rise? So we, up in the columns, you see that we have the different hazards and risk levels. And on the left, we have the different components that we are assessing and the ones that were, and the levels of vulnerability we are looking out for. So you have things that could easily be affected by climate change hazards, such as water, sanitation, and hygiene, waste, healthcare, waste management. You know very well that if you don't have alternative sources of water during drought, what will happen? You'll not even be able to clean the health facility. And if you don't do good cleaning, you know what happens. Okay. So the results I'm presenting here, I beg indulgence, don't get confused. This is a vulnerability and adaptation assessment. The two are opposite of the other. If you have a good adaptation or good resilience systems, you will have low vulnerability, okay? So when you see flipping of these, the results here, it means the other side is showing vulnerability, this side is showing adaptation mechanisms. So let's say the health workforce, we're saying that the health workers participate in drought, water, and climate change adaptation plans and policies. If that is really happening, what would you expect? You'd expect them to be resilient because they participate in putting up plans and policies to protect themselves. Okay? That's what we want to come out in the plan. When we develop the plan, we want to be able our health workers to be able to participate in drought, water, and climate change adaptation plans and policies, and all the rest as we go down. So the current situation is that we have high levels of vulnerability because they are not doing these things. So the levels of vulnerability are indicated there as red, and where they are doing something, they are falling in green. You'll find low vulnerability, okay? So what you're seeing there is the number of facilities or percentage of health facilities that do not have these resilience mechanisms in place. Okay, so here is the WASH and healthcare, water sanitation and hygiene, and healthcare in healthcare settings, and healthcare waste management, where we have some indicators such as healthcare facility has water management plan to identify water contamination, for example. We know that when it floods, water sources get contaminated. So our health facility is able to tell that their water sources are contaminated. If they are able to tell, then they are not vulnerable. But if they are not able to tell that their water source is contaminated, then they have high vulnerability. Our results show that you see that nearly 60%, this is 53, are vulnerable. They don't have any contingency plans for monitoring or reducing contamination. So meaning that whenever it rains or floods, the contamination go in the water sources and nobody gets to know, and they just continue to use the same water. When it comes to energy, we are trying to see, do they have do they regularly have an emergency backup generator to be able to cover them in times of crisis? And do they periodically check this emergency backup generator? Do they have it in a place that is protected from, for example, from flooding? These simple checks are the ones that we check down at the health facilities. Now, okay, thank you. So I just wanted to pause and say that while we are assessing vulnerability of the health system, because it is the health system that responds to the other outcomes of climate change. So if you said that climate change leads to increased malaria, so what? So you need to build a system that is going to address the other outcome. And that's why for us we are focusing on the system and trying to assess to what extent is our system robust. Okay, since now I've given you the whole structure of how we are doing the assessment and results, I'll just quickly scan through. So if we see the impacts, That was vulnerability. If we were to look at the impacts, the proportion of health facilities that are actually impacted by drought, you remember the first graph I showed up there. It is the different numbers are indicated here, and the components of the health facilities actually affected. You look at the health workforce, look at WASH, look at energy, look at infrastructure and technologies, being able to relay data in time, etc. And how actually does drought, for example, affect the workforce? So the data is quite desegregated to see how each of the hazards affects a particular component of the health system, so that when we're planning, we're discrete enough to address the real issue. Okay, so just quickly to conclude here is that, okay, we found high levels of vulnerability. And this is because they are unprepared. In terms of energy, they are unprepared. They don't have backup power solutions. And where they are, there are no systems to regularly check their safety. And then the health workforce don't really participate in climate change adaptation plans. And they also don't have any protective gear when they need to. And then when it comes to WASH and healthcare waste management, there are insufficient strategies for monitoring and reducing water contamination, limited preparedness to vector breeding at the facilities, hazards in waste storage, they are not adequately secure, and also the infrastructure systems have limited post-hazard recovery plans. Yeah. So part of the resilience plan is recovery. For example, Kilembe has experienced that. What does it take for it to come back to its feet? If it doesn't, it's not able to come back, meaning it means that it's not resilient, okay? It has high vulnerability. It cannot come back to how it was. Yeah, so that is what and our stakeholders raised some recommendations, but we think we'll get a lot more when we do a stakeholder validation workshop of these findings next week on Tuesday. We will invite some of you to write for another workshop where we shall go through in detail and discuss the findings and use the findings to develop a national adaptation plan. So this is the roadmap. We look forward to further interaction. Thank you.
Thank you, Mr. John Bosco. Thank you very much. And because you called for an interaction, I know most of you, just like me, have so many questions that you have in mind from our previous presentations. So I would kindly request our previous speakers, that is Cecilia, Didas, and John Bosco, to kindly come on the panel, and we have a few questions from the audience. But in meantime, please, I know all of you are using social media, and I'm not seeing us trend online. And we are saying that the climate and health topic is so much sidelined. It shouldn't be sidelined even when we are engaging. And we are, in the digital era, so we have to, trend. Please make some posts about this symposium. Make us trend, because we want the health and climate change topic to trend, So please, Cecilia, Didas, and Mr. John Bosco, please, can you have a seat? And Doreen will help me move the microphone around. If any of you have questions or a question. Please make use of those. Oh, okay. Yes. Yes, yes. So, we are taking questions now. If you have any question from the NDC presentation, from the NAPA presentation, and the most recent one, you can fire it to our speakers, please.
Yeah, thank you so much. I am Charles Kaviswa from Regenerate Africa. And I like the conversation, and thank you so much, the tree adoption, for bringing different stakeholders to have this healthy conversation on the climate and healthy connection. I have 2 comments and then 1 question. The 1 comment to Cecilia. I think in the presentation we missed a stronger slide on the health adaptation priorities which are included in the NDC. Because, you know, the health folks in here are more concerned to see that intersectionality of the health into the NDC. I think that was very, very important to have. At least there's, I think, around 2 pages which are talking about health as an adaptation priorities within the NDCs. But I'm happy that the document is available online. Then also I had a feeling that because of that change in the revised NDC, the positioning in terms of the NDC scorecard is putting Uganda in a very far higher position, because what you referenced is a post of May 2022, and yet our posted updated NDCs were in September 2022. So when you look at the UNFCCC scorecard, Uganda and the Marshall Islands are put almost at #1. So we are doing much better, and I want to encourage, of course, thank the government for doing that landmark. Then to Didas, I wanted to know now, because we are talking about the NAPA, which in my view they are all the NAPA. So where is that linkage? How are we transitioning? Of course, there is already evidence on the health impacted by climate, but then how are you informing, for instance, the ongoing process of John Bosco and the colleagues who are now transitioning into developing the health NAP? The last one is on the study which is going on. I am a bit worried because I see the focus is mainly on the workforce and the health facility. And again, when I look at some of the recommendations, of course this is preliminary data, there is again a siloed way. We are now moving away from siloing, being in a sector kind of mentality in our programming, including our research, to bring sectors together. And that's why the health sector hasn't been getting funding. There is barely no GCF funding to the health sector, probably, apart from one that has just been approved, I think a month ago. I can get the statistics. So we are siloed as the health folks, because we are not building a case, a business case on the impact of health and the climate. So I see this in the study, because we cannot focus entirely on the health sector facilities and the workforce, minus now moving down into the women who can't access, for instance, maternal services, the sexual reproductive health facilities and services, family planning. So the access, the demand, because the roads are impassable, the nutrition that suffocate even the health indicators. So I think for me, we shouldn't focus. We need to extend a bit into, I think get some hotspots and get some data on the real communities that are being impacted on the health aspect, so that we can inform the NAP, health and NAP. And this health and NAP has to be intended to be intersection. We have countries like Tanzania, they have had it for 5 years and no single funding, and now they are revising it because they siloed it. So we have to benchmark it with some of those either failed or successful NAPs that are sectoral NAPs.
Thank you very much. But I would request that next questions we should at least have one or two from one person, because at the end of it all, we might have one person asking questions. So.
Okay, thank you so much, moderator. My name is Robert Tuyachira from the Environment Shield. For me, I'm not worried like my friend Kabiswa, who is very worried. And I want to start from the issue of mental health. It is true that this discussion is timely, and personally I'm very excited about it. It's an area I'm paying a lot of interest in. And I want to ask the Minister of Health how we are equipping our mental health facilities to ensure that we accommodate the big number of people who are actually being ravaged by these climate-related disasters. Because we see, for example, when you look at across the country, River Kafu flooding, we've been seeing all these places which are affected by disasters. The people, their state of mental health has been so much affected. But we see still the mental health facilities, like for example, Butabika, is not being prioritized to actually handle some of those numbers. So how are we ensuring it we mainstream? Because I was reading a report the other day which was run by Monitor that 30% of Ugandans actually have mental health challenges. Yes. And this is being worsened by climate-related disasters. So that is a question to the Ministry of Health. But the other bit also is how do we ensure, because this discussion needs, as you said, we need to really widen it, to broaden it, especially among young people. Because talking about mental health, young people are the biggest victims of mental health challenges. So when you look at the dichotomy between human health and veterinary health, there seems to be now that that does no longer work. So we need to have a one health approach, because we saw with the rise now with the pandemics, I was trying to do some reading about the zoonotic diseases, where it is showing that because of the migratory pathogens and the vectors, for example, like what happened with COVID-19, that we are on a tenterhooks as a population, that anytime we may get another pandemic. So how are we preparing ourselves as a country, as a Ministry of Health, to ensure that actually we prepare for the next pandemic and then give a one health approach? Because now with the migratory vectors, we can no longer say we are sticking to only human medicine. We must now have a one health approach where we can be able to strengthen the system and probably see how we can build capacity to cope with other pandemics. Thank you so much.
Thank you very much. I think your question is recorded. Please, Doreen, can you be gender sensitive? Huh? I have a question here. And I keep asking people, whenever we are in such engagements on health and other intersections, are you among the 14 million Ugandans who are in that report of Daily Monitor, or you are among the other people? Just a question.
Thank you very much. Good morning. My name is Comfort Hajra Mukasa. I work for Amref Health Africa in Uganda. Yes, my question may not go to Didakas per se or JB, but it's for all the three. So yes, we're taking through these processes, and Didakas rightly said some of the activities we wanted to do in the past were not done, and now we want to tap into local resources. How prepared are we to involve the private sector right now and not wait for us to finish our processes, then think about bringing them on board? And to add on to the previous speaker, Uganda is predominantly youth. So how do we involve them now? We're talking about social media, but how do we involve them now to get on board and drive this agenda in a language that they understand? So meaning digital solutions. So if you're thinking of maybe whatever we're going to do, modeling, all those things have to be palatable to the youth. And then not to just sound like a woman, but I'm a woman, so I'll say it. Women are the brand bearers of the impact of climate change. When Kalembe was swept away, trust you me, the women felt the impact more than the men. The men do feel the impact too. But then my concern is, why are we going to wait to finish all the processes that come with a plan? Then we remember, oh, so the women, we found all this, but how do we involve them right now? And then make sure that they're part of the things that we plan to do, as opposed for us planning for the youth, the women, and then throw it onto them and say, this is a beautiful plan, let's involve the youth, private sector, implement. Thank you.
Thank you, Hajira. And I'm taking one last question here. Please, here. Interesting.
Thank you very much. My name is Dr. Christine Navidio, and I represent Path Africa. And my colleague Derek, thank you very much, Derek, for smuggling me into this room. I'm so excited and proud to be Ugandan when I see this, because we don't need to be worried. That is where it starts. If we have this, then we are covered. I want to thank the organizers, and then just one question, because all the comments are actually answers. Tulimu answer mwe tuzanyedde. So we already have the plan. And I also want to thank Professor Batte, who has, and the team that has been the organizers, a hand clap to them before the end of the meeting. My question goes to the only presentation I listened to, and for the rest I hope I'll get the PowerPoints, because I need to smuggle this into other countries in Africa. Right now we are writing a proposal that needs all this going into that. You talked about energy, and then you talked about backup of fuel, and I was like, climate change, fuel-backed energy systems, fuel? So I was a bit confused there. I was thinking you were going to say solar and that kind of thing, so that's my question.
Thank you very much. I'm taking, oh my God. The more I take, the more I get other, so please, can we have it at that? Yes. I'll start with Didas.
Yeah, thank you very much, moderator. There are several questions which have been presented, but the ones directed to me are quite a few. The first one was on linkages of the NAPA 2007, now almost 20 years. How is it linking the current processes like the VAA? First of all, it is literature. Academically, you have to, I think they have reviewed the methodologies, for instance, what we did. At that time it was PRA, but now he didn't have time to present, but we have a component of engaging the communities through the VHTs to find out what are the views of these people, how is climate change affecting the communities, how are they responding. We have that component of the VAA. So it will enrich us the views and how people are responding at community level. Then there was also a question on working in silos. I think we are not working in silos. Our methodology is going to have consultations with almost all the sectors, because health cuts across all sectors. As Muhammad mentioned, the road accidents, that is transport, affects health. Water affects health. So we are not working in silos. At the right time, the VAA process is going to engage with all the sectors, all the NGOs, all the CSOs will be involved. The youth, Hajira mentioned about the youth. We shall engage them. We want to get representatives of the youth, because Uganda is largely youth. We need to get their views. We have to get them on board. How do we engage them to improve their health? Reproductive health is very critical. A lot of pregnancies during COVID-19, a lot of young girls, school-going girls, had early, even some were married, early pregnancies. It's a big shame that we could have a big population of our youth get early pregnancies and have no issues. So climate change is also adding to that problem. Mental health, somebody mentioned about mental health. It is indeed a big problem. It is not expanding at the rate we would want it, but an effort is taking place. All the regional referral hospitals, all the general hospitals in the country have a unit on mental health. But we all know about Butabika and the major hospitals. But and we have 17 regional referral hospitals in the country. They have a unit on mental health. So we need to be aware of this and use this service. It is not very advanced yet, but we are heading there. The last question was on women. Women, I think through the community interface of our study, we shall get the views how we can engage the women. Lastly, he mentioned about the hotspots. Our sampling touched on all the areas of the country. The highland areas, if you saw the number, 43 districts, the climate change prone disaster areas like Kigezi, like Kasese, like West Nile, like Elgon region, they were all part of the study. So we think all these will help us get rich information that can inform our HNAP, Health National Adaptation Plan, which we think should be implemented. We are going to the COP. Let's go there and support us in a multi-sectoral way so that we can get people to fund this work plan so that we can excel in the whole world. Thank you.
Thank you very much, Titus. I'll first have Mr. John Bosco because a lot of questions were coming to leaders and John Bosco.
Thank you very much, Presenter. Yes, thank you, Mohammed, for these questions. We are not working in silos. He has already clarified. We are going to have a stakeholder validation workshop, and even the people that we are picking this information it was really from a wide range of stakeholders. And we are, in this workshop, we will have a code design to make sure that Hajara's Kafat's concern is addressed of how we are bringing the CSOs and the private sector on board. We want to engage you in the code design of the plan. So you are really going to be hands-on to come up with this plan. And I think Dr. Christine talked about sustainable energy, that we are talking of backup generators. Now, this was an assessment of what is on ground. It's not the plan. So the plan will have to look, to really read and see what is right for climate change. We have to look at both the contribution of the health sector, how to cut it down, and how to be resilient to the effects. So on how to cut it down is going sustainable energy. We have already piloted a project with the WHO in 36 facilities here in Uganda, and I think 25 in Ghana. And this was really powerful because it would provide solar energy to even the staff quarters. So, and they would only consume 5% of the capacity of that project, meaning that it was built for the future. Even if it moved from health center 3, 4 up to hospital, that energy would still power. So that's the kind of projects we want to lobby. And that's the reason why we want to take this to COP28. We don't want to just stop at assessment and do the plan. Someone talked about the risk of having it documented and then we can't implement it, like in Tanzania. For us, we wanted to start really with high power. And we have a special meeting in January that will engage high-level people. Ministry of Finance, climate financing, all the donors that we can reach. And that is why we are going to pitch it at COP, so that we get other actors involved in implementing not only the national plan, but also the disaggregated plans at facilities and districts. Okay, and I think those are all.
Okay.
Yeah.
Okay. Cecilia, any comment? Just in case you have any question.
Yes, there was an issue on health adaptation priorities from the gentleman over there, and maybe I would like to invite my principal climate change officer, Mr. Muhammad Semambo, to give more clarity on that issue. Yeah, your question was on adaptation priorities and how health can be.
Principal.
Thank you very much. Today I wanted to listen in more, not to sit your side, but I don't know if even I recall them. But the most important thing is that, thank you very much, Charles. We have around 4 major things in the NDC, and they are tilted on adaptation. One is about increasing surveillance on the health and climate change diseases. And I think this is really very important because the first principle. Number 2 was about mainstreaming climate change and health in the sectoral plans and budget and projects within the health sector. And it was very, very important. That's why the work is doing will get the mainstreaming. Number 3 is to develop an holistic plan, which is the HNAP they're talking about. And then number 4, I think was, if I recall, number 4 was about early warning systems. Number 4 is about the early warning systems. But of course, there are other cross-cutting issues like building capacity, awareness. So if I have a chance, I would also ask him, because I have something that we need to talk about what he has presented. Thank you very much.
Thank you, Principal Climate Change Officer. And I want to re-echo a few things on mental health, because I'm so passionate about this topic, and the intersectionality between climate change and mental health is quite alarming. I mean, we have to also understand our population, Uganda's population. The young people are one of the most affected groups. And if we are designing these projects, we have to look at youth-friendly work plans, because we might plan so well, but going down to implementation, it is a challenge because we have not studied well our population. So we have to look at friendly practices in ways in which we can downscale our work plans and implementation. So with that, I want to invite you to our next session, which is, I think you can, next session, which is tea break, but we are going to have a working breakfast because we have a lot of activities, and we don't want to miss out because of time. So we're going to be calling tables to have breakfast, but in the time of breakfast, we're going to have young people, young health professionals who are going to expo, then we can rotate. Is it? Okay. So in the meantime, we shall use this time to, the DJ, please. Can you have some sound to move the breakfast and the poster presentation session? And please, I can see new faces here. I'm looking forward to networking with most of you. So I hope that all of you are looking forward to that session. So in the meantime, you can also use that to get to know each other and network. But please, DJ, do something. Yes. Yes? You have a question? Okay. Can we move the mic? My colleagues. Doreen? Doreen is not around. Another microphone, please.
Good morning, everyone. My name is Paul Kato with Ugandans for Environment and Climate Change Action. I would like you to all give a round of applause to Dr. Bate and the team. Those of you who are not aware of tree adoption, they are doing a very good job with the youth. We actually participated with them at the National Tree Planting Day sometime back in, I think 2 months ago in Kajansi. And we had partners like Roofings Limited. They were planting, there's a target to plant millions of trees. And what is the importance of the trees? The trees are acting as carbon sinks to try and reduce the carbon that is circulating in the atmosphere. So what would be bothering me right now is we are seated in a hotel room, which is probably set at around 20-something, 5 or 6 degrees. No, 18. It's supposed to be set around 26, and maybe the windows should be open, and then we could have this hotel contributing to climate change action. So, Dr. Bate and the team, thank you very much for this. We are very ready to add our voices to this conversation. And for everyone attending, thank you for coming. This has been a long time coming. What we do as an organization, we engage with the youth as well. We have waste management workshops we take to schools, especially the junior schools, and also do surveys on waste management in schools. And I think these are the areas to begin with, because if you're moving around Kampala, it's very easy to see somebody drinking a bottle of soda and then throwing it out of the window of their car. And it's normal in Kampala. Nobody questions, everybody goes their own way. But we have to instill this in the young population, especially the kids in the early classes. We have to let them know the importance of waste management, the 3 principles of reuse, reduce, and recycle, so that even the sector of recycling can get more funding from government and other supporters. Thank you very much. Enjoy your breakfast, and let's make sure we keep less waste around. Thank you.